Coming to the intracranial hemorrhage. The intracranial hemorrhage can happen either beneath the dura or above the dura, which we call it a subdural and epidural hemorrhage, and it is more common in term babies. It can happen beneath the arachnoid layer. We call it as a subarachnoid hemorrhage. It can happen both in term and preterm. Next, if it can happen inside the brain, it is intraparenchymal hemorrhage. If it is happening inside the ventricles, it is intraventricular hemorrhage. So, both this intraparenchymal hemorrhage and intraventricular hemorrhage does not usually happen as a process of birth injury. Usually, it is happening in the neonatal unit. So, it is not because of generally birth injury. It is because of hemodynamic instability and other venous infarction. So, it is not, these two are not a process of birth trauma. So, let us concentrate on what is happening above and beneath the dura, which is subdural and epidural hemorrhage, and beneath the arachnoid, which is a subarachnoid hemorrhage. So, let us concentrate on these two things. So, what is the cause for subdural and epidural? It could be due to because of vertical molding, or it could be due to the torsional force during delivery, or it could be due to the subdural is mainly because of venous, because of rupture of the dural venous sinus, and this is the most common intracranial injury. So, you need to remember this. The most common intracranial injury is SDH, which is subdural hemorrhage. Extradural hemorrhage is very rare and it is due to rupture of artery. So, coming to what causes subarachnoid hemorrhage, it can happen due to trauma during delivery or due to extension of subdural or parenchymal hemorrhage. And remember, this is the second most common cause for intracranial hemorrhage. I repeat, this is the most common second most common cause for intracranial hemorrhage. The first most common intracranial hemorrhage is the subdural hemorrhage, and the second most common hemorrhage is the subarachnoid hemorrhage. So, if you see here, what has happened in the scalp is extracranial hemorrhage, the injury which is happening beneath the periosteum and beneath the bony structure, you call it as intracranial hemorrhage. There is a huge collection of blood here, which is in the extradural space. So, here you can see that the hemorrhage can be in the subdural region, or it can be in the extradural region, or it can involve inside the parenchyma, or it can be in beneath the arachnoid, which is subarachnoid hemorrhage, or inside the ventricles, which is intraventricular hemorrhage. As we already discussed, this intraparenchymal hemorrhage and ventricular hemorrhage is more common in preterm babies. That is why ultrasound screening will be done in the neonatal unit for all preterm. Whereas SDH, subdural hemorrhage, extradural hemorrhage and subarachnoid hemorrhage can happen as a process of birth trauma. So, moving on to the presentation, the subdural hemorrhage, if there is a large subdural or extradural hemorrhage, it can present with raised ICT. It can present sometimes with even brainstem compression. So, if the brainstem compression happens, they can even die. The baby can die even without arriving at the diagnosis. So, we can do a CT or MRI to look at the parenchymal pathology. We have to do a symptomatic treatment and neurosurgical intervention. Coming to subarachnoid hemorrhage, they present with seizures, irritability, altered mental status, and CT will be diagnostic. Again, it is a symptomatic therapy. If we are looking at parenchymal or intraventricular hemorrhage, the intraparenchymal, depending on whether it is cerebral, it can cause a focal neurological sign, or cerebellar, it can cause brainstem compression, and usually we do a MRI. Again, it is depending on whether the child is symptomatic or asymptomatic. Generally, conservative treatment are being advocated. Intraventricular hemorrhage, usually ultrasound itself can be diagnostic. They can be clinically silent, or it can be evolving over hours to days, or it can be catastrophic, which happens with the shock, and it can present within minutes with apnea.